Hello and welcome to Medical Dialogues. I'm Dr. Garima Soni. Let's look at today's top medical news. How Manuka honey might help with breast cancer. A recent study reported in the journal Nutrients outlined the promising role of Manuka honey in prevention and treatment of breast cancer. In 2022, approximately 2.3 million women globally were diagnosed with breast cancer, which ranks as the second most prevalent cancer worldwide. Around 80% of breast cancer cases are estrogen receptor positive, indicating that the cancer cells have receptors that attach to estrogen and may depend on the hormone for their growth. Treatment options for estrogen receptor positive breast cancer currently include surgery, chemotherapy, radiation therapy, and hormonal therapy. Previous research has also explored complementary and alternative medicine for treating estrogen receptor positive breast cancer. This includes antioxidant, supplements, yoga, mindfulness practice, and acupuncture. New affordable rapid diagnostic tool to detect brain cancer. A recent research published in Communications Biology has discovered an automated device capable of diagnosing glioblastoma, a fast-growing and incurable brain cancer, in less than an hour. The core of diagnostic tool is a biochip that utilizes electrokinetic technology to identify biomarkers, especially for active epidermal growth factor receptors. These receptors are commonly overexpressed in cancers like glioblastoma and are present in extracellular vesicles. Researchers face two main challenges: developing a method to differentiate between active and inactive epidermal growth factor receptors, and designing a diagnostic technology that could both detect and selectively identify active epidermal growth factor receptor on extracellular vesicles from blood samples. To address these issues, they designed a biochip featuring a low-cost electrokinetic sensor roughly the size of a ballpoint pen's ball. The sensor's small size allows antibodies on it to form multiple attachments to individual extracellular vesicles, which greatly improves the diagnostic sensitivity and selectivity. Gut microbe metabolites can modulate heart disease risk. A recent clinical research has indicated that phenylacetylglutamine, a newly identified metabolite produced by gut microbes, may influence the risk of developing cardiovascular disease and heart failure. A recent study published in Nature's Communications investigates the mechanism underlying the link between phenylacetylglutamine and negative cardiovascular effects. Chronic non-communicable disease accounts for nearly 75% of deaths worldwide. Cardiovascular diseases, heart failure, and related conditions represent a major portion of this mortality, highlighting the critical need to enhance current diagnostic and treatment methods. As research progresses, the connection between diet, gut microbiota, and public health is becoming increasingly clear. Emerging evidence links gut microbial communities to various psychological and metabolic conditions including obesity, diabetes, and cardiovascular disease risk. Safety of low-intensity blood stem cell transplants for lung health in sickle cell disease. A study published in the Annals of the American Thoracic Society indicates that low-intensity blood stem cell transplants, which involve milder conditioning agents than those used in standard transplants, do not appear to harm the lungs and may potentially improve lung function in some patients with sickle cell disease. Damage to lung tissue and impaired lung function are significant complications and major causes of death in individuals with sickle cell disease, a severe blood disorder. The new study examines whether less intensive types of transplants, which are often better tolerated by many adults, contribute to or exacerbate lung damage on their own. Until recently, bone marrow and blood stem transplants were the only available cure for sickle cell disease. However, relatively few adults have received this treatment due to health risks associated with the high doses of chemotherapy needed to prepare for the transplants. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.